Hello, my name is Caitlin Germano, and my group and I decided to do a presentation on pediatric pathology and complications of pregnancy and prematurity. So I did question number 1, which is what is the pathology? And I found that there are numerous reasons why an expecting mother would have pregnancy complications that would lead to prematurity, and there are 3 main types. The first type is pregnancy pathology, which include maternal diabetes, preeclampsia, maternal hypertension, a stain amniotic fluid, premature rupture of the membrane, and others. The second main type is pathological births, which include premature neonates, neonatal sepsis, neonatal death, neonatal resuscitation, and others. And the last type is pathological placentas, which include infection, fetal malperfusion, maternal malperfusion, intervillous hemorrhage, and others. And I also included a diagram in this first slide, mainly on the placental dysfunction and the major organ damage to a mother. And then in my second slide, I kind of just continued on. I found that there was a study done at the University of Bari on 439 pregnant women, and they found that in the normal pregnancies, 157 were psychological pregnancies, and 282 were pathological pregnancies. They also found that normal placentas was in 57.5% of the normal pregnancies and 42.5% of the pathological pregnancies. Normal infants showed a high degree of correlation to normal pregnancies, and in the neonatal diseases, infants with SGA, which is also known as small for gestational age, had a high degree of correlation to pathological pregnancies, and they concluded that intrauterine deaths reported a higher incidence in pathological than comparing to normal pregnancies. And I also included 2 pictures of babies in the intrauterine deaths, one in the middle of one, and then the other one, that one already passed away. Then my last slide, I kind of focus more on preterm birth, and I found that preterm birth is also a common cause for neonatal deaths, accounting for around 12% of all newborns. And in preterm pregnancies with intact membranes were more likely to develop hypertension. And also MVM and AI are 2 that might be associated with increased risk of certain diseases. And I also included 2 pictures of babies who were born prematurely. They usually are put in the NICU and they're hooked up to a bunch of monitors until they're more developed so they can be on their own. But yeah, thank you for listening, and this was my part of the presentation.
One might ask themselves, how does conventional medicine treat this pathology? Well, my focus is treating preterm labor and preemie babies. So that first we would determine if there is a high-risk pregnancy, and if there is, what would be the best treatment action plan? Would it be hormone therapy, replacing a hormone that the female body naturally makes? Would it be surgery, closing the cervix so that the baby does not come through prematurely? Or there's non-medical treatments such as stress relieving practices, not using drugs and alcohol, consuming daily nutrients like folic acid and things are always imperative during pregnancy. As you can see here is an example of what the cervical clerge would look like. So there would be, this here is a natural, non-affected, non-dilated cervix. Here we have fully no dilation, but here we can see the cervix has begun to open. This is where the surgery would take place, and this area would be closed shut. And if premature birth does occur, the first action plan is to get the baby in the NICU, which is a special unit designed specially for premature babies, and get the baby into an incubator. Feeding tubes will be placed inside of the baby so that the baby can receive nutrients and breast milk and things of that nature. Medication is also issued just in case there's any infection or to reduce the risk of illness. And lastly, we will monitor the premature baby's vital signs. And in the next slide, I have examples of that. This here would be our NICU. And these are special incubators that the babies would nest in until they are well enough to come home. And as you can see here, the baby has little attachments to their chest, which is monitoring the baby's heart rate. And here you can see a mother caring for the child in the incubator, and you can slightly see the feeding tubes coming from the child where the baby is receiving the mother's milk and other vital nutrients. Other steps that are taken after a baby is prematurely born, we have the kangaroo effect, which is where the baby is placed on the mother, wrapped tightly to provide skin to skin contact, as well as lights provided and a special mask provided to help the child and rest more easily. Oftentimes, blood is received from donors, and surgery is often needed for babies when they aren't able to breathe on their own or need other type of support, such as feeding tubes, gaining weight, things of that nature. And here is our example of the kangaroo mother care. As you can see, the small preemie baby is wrapped tightly close to the mother with straight bare skin to skin contact. Isn't that amazing, you guys?
Suggested lifestyle changes and or alternative interventions before and during pregnancy would be to gain and maintain healthy habits physically and mentally. This will help reduce the risk of things like miscarriages or preterm birth. Preterm birth may be considered anything before 37 weeks. It's best to be up to date with any immunizations or necessary things on your medical records. Other ways to gain and maintain healthy habits physically and mentally would be to seek therapy for depression, anxiety, or any other mental health things that you would need support in, as both exercise and therapy will help promote healthy cell growth before and during pregnancy. Exercise will help a lot with increasing endorphins, which are associated with positive feelings chemically in the brain. And those will also reduce stress and relieve stress, reduce anxiety and depression, and relieve that as well through exercise. It will help increase energy, improve overall fitness, reduce back and pelvic pain, which will especially be helpful during pregnancy. It'll also decrease the risk of complications like preeclampsia and pregnancy-induced hypertension. It'll also help with things like medical conditions, people with diabetes, things like that, or also prevent gestational diabetes. And it will also help prepare your body for the demands of labor and pregnancy and help with a faster recuperation after labor. Exercise will also help with the management of urinary control, which is especially hard during pregnancy. That would be the best place to ask for pelvic exercises that are okay during pregnancy. Exercise will also improve posture and circulation before and during pregnancy. It can help improve sleep and manage insomnia if one would have that. It also is good to be mindful of hormones like relaxin that will loosen ligaments and increase the risk of sprains and other injuries. It's also good to be mindful that the body center of gravity will change, which may alter the experience with balance and coordination. It is also recommended that people who are pregnant do not base off of heart rate when exercising, as this changes during pregnancy, and that during second trimester, blood pressure drops, so it's important to avoid rapid changes in positions, which can affect the experience with dizzy spells. It's recommended to generally exercise 30 minutes per day with moderate intensity. If one has not been exercising very much before pregnancy, it's suggested to start with low intensity physical activities like walking or swimming, and then increase slowly. If 30 minutes is too much, it's suggested for people who are pregnant to split it up into 2 15-minute workouts per day. It's also good to avoid raising body temperature too high, and make sure to do controlled stretches to help the body throughout the exercises as well, and not to exercise to exhaustion, just to exercise to maintain. It's also suggested to avoid abdominal trauma or pressure, so avoiding high impact exercise and high impact sports. Warning signs during or after exercise would be like headaches, dizziness, feeling faint, heart palpitations, chest pain, swelling of any body parts, vaginal bleeding, contractions, back, pubic, or pelvic pain, cramping in the lower abdomen, walking difficulties, unusual change in baby movement, amniotic fluid leakage, unusual shortness of breath, excessive fatigue, and muscle weakness. Another recommended way to gain and maintain healthy habits would be to have a balanced diet or seek one. Inadequate healthy nourishment can lead to increased risk of heart disease, diabetes, and high blood pressure in the mother and the baby. It is suggested to have 5 or more portions of vibrant fruits and vegetables, given that these contain important vitamins and minerals like vitamin A, C, E, iron, folate, etc. It's also best to wash off all excess soil from fresh produce to reduce toxoplasmosis. This can harm an unborn baby. Necessary parts of a healthy diet would be whole grain starches. They're a good source of fiber, and to drink plenty of water when doing so, since fiber absorbs water. Calcium-rich foods, but avoid mold-ripened soft cheese to reduce risk of listeria. This type of infection can also affect an unborn baby. We want to eat meats if that is part of your regular diet. Those are a good source of protein, vitamin B12, and iron. They prevent iron deficiency, and it's best to make sure they're thoroughly cooked to avoid toxoplasmosis, which again can affect an unborn baby and results in things like miscarriage. We also want to include fish if that is another thing included in your regular diet for protein. It is recommended to have 2 portions per week, and make sure to have one that's oily. Tinned fish like salmon, sardines, mackerel, plicards are a good source of omega-3 fatty acids. Those are really good for your heart health. White fish like cod, haddock, and collie are a good protein that are low in fat. It is suggested for people who are pregnant to avoid shark, marlin, swordfish. These have high level mercury and can damage an unborn baby's nervous system as well. Shellfish is also suggested to be avoided because these can contain bacteria and viruses that will cause severe food poisoning. Eggs are also a good source of protein, and make sure to do good practices to prevent salmonella.
Beans, peas, and lentils are also a good source of protein and fiber, vitamin B, iron, and they're more affordable protein for increased protein diets. It is also best to reduce and avoid fatty and sugary foods, as this will increase unhealthy weight gain, which can affect the mother and the baby during and after development. It's also recommended to have no more than 2 cups of coffee a day, as caffeine can lower the birth weight and cause spontaneous miscarriage as well. And again, reducing and avoiding the fatty and sugary foods can also help reduce the risk of gestational diabetes and developing diabetes type 2 after giving birth as well. It is also suggested to avoid smoking, alcohol, and use of drugs, as this could interfere with the fetus growth and can cause preterm birth, miscarriage, fetal death as well. It can cause long-term damage that will require necessary specialized care after birth, and it can increase long-term medical and behavioral problems all the way into adulthood as well. It is also best to gain and maintain control of diabetes and other medical conditions for many reasons, including the ones listed previously. It's also suggested to increase daily intake of folic acid, one of the B vitamins, to at least 400 micrograms. Folic acid helps with the neural tube, and the neural tube is what helps form the early brain and spine. So when we increase the folic acid, it'll prevent major birth defects associated with the baby's brain and spine as well. And it helps make new cells. And last but not least, to avoid exposure to potentially harmful substances like lead and radiation. This can help reduce the risk of problems during pregnancy. Lead and radiation can cause miscarriage, especially early exposure, 2 weeks and under. It can also cause malformations of body parts and developmental delays, especially during the 2 to 8 weeks part of the pregnancy. This can also cause cancer in the mother and child. And it's also suggested to talk to a healthcare provider about taking any medications that will affect or interfere with a pregnancy or in efforts to get pregnant. Babies who were born 36 to 37 weeks are considered mature enough to go home. With that, it is still suggested to monitor closely for infections or changes in breathing or heart rate, etc. Anything before that is not considered mature enough to go home, and a lot of times are known to stay in what is called the NICU, or the neonatal intensive care unit. There they monitor closely for infections, changes in breathing and heart rate, etc. also, but they're also able to do tube feeding if necessary. Tube feeding is not typically necessary if the baby is able to breathe, suck, and swallow independently. They are also kept in the NICU to keep warm in enclosed cribs called incubators or isolates until they can maintain their own body heat. In the NICU, they're also able to receive oxygen through an oxygen tube or a machine called a ventilator. It may not be necessary if they have the ability to breathe independently or until their lungs develop. The incubator or oscillate is also used to be a barrier for barrier to drafts and germs. The nasal cannula, it's a thin tube with 2 prongs, is typically placed in the nostrils to assist with oxygen or there is like a plastic hood that goes over the baby's nose and mouth to also assist with oxygen. Um, they also have preterm infants are recovering and still developing, so it is advised to avoid waking them up. The more rest they get, the more their body has time to heal and grow and develop. Their brains are also not fully developed to be alert, so they're easily overstimulated. And that can be triggered from your gaze, your voice, your touch, by sounds or lights in the room. More mature preterm babies can benefit from kangaroo care, infant massages, calming music, etc. It is advised to feed breast milk. If they are tube feeding, it's fine to do that through tube feeding until the baby can independently feed. If breast milk is not chosen, then formula also is okay. It's advised for parents to learn CPR and first aid for infants and children, to learn safe transport for the baby, medication and equipment if medication and equipment is necessary, necessary care for handling medicine and medical equipment as well, not just the transport. It's also good to make sure the baby sleeps on their back to avoid SIDS, sudden infant syndrome. Crying can be averaged up to like 3 hours a day by the 6 weeks for average birth and preterm birth. Uh, the best way to support their crying and comfort is to create a more calming environment and hold them often to reduce overstimulation. It's best to not keep feedings longer than 4 hours in between, as this can dehydrate and cause other challenges in the future if you do so. Small feedings do help reduce spit up. This is really helpful for things, especially like acid reflux or other eating challenges surrounding those things. It's also good to add iron, vitamins, or formula to the breastfed diet to assist with iron stores, energy, etc. Preterm babies are more susceptible to infection and disease, so regular checkups are recommended, as well as the recommended immunizations to protect against serious illnesses. Babies are suggested to be kept away from sick family and friends and avoid group care until the baby is no longer considered a high risk for infection or disease. It's also best to avoid exposure to smoke with preterm and the average term baby, as again, their lungs are still developing and it can cause a lot of damage. 31 weeks or less, or weighing less than 2.8 pounds, are more likely to develop vision complications, so it's also best to regularly schedule checkups for vision and hearing as well. Children may catch up to full-term babies around age 2. For the parents' health as well, it's best to seek support through group therapy, or support groups and therapy for each individual to kind of assist in navigating the new lifestyle necessary to move forward.